Okay, remember I said in ICD you go to the condition or the disease in the alphabetic index to figure out where you need to go? It's a lot broader in CPT. So to locate the main term, you can do a lot of different things. Okay, you can go to the procedure or service. You can go to the organ or the anatomic site. You can go to the condition, meaning like a cyst or something. We kind of know what that means. You can go to the substance. So in that case, I mean, for example, like blood or urine or something like that. Fecal matter, yes, that's right. I can go to look for a synonym. So, did I spell that right? So for example, I could go, if I can't find it under finger, I might look under like intercarpal or something, you know what I mean? Something like that. Yeah. So, in a pinch, you gotta kind of think outside the box. An eponym. An eponym, you'll find these in ICD too. Eponyms are things named after a person or place. You're going to probably see more of them in ICD, like Parkinson's disease, Alzheimer's disease. Alzheimer's is named after the doctor who identified it. Okay. Lyme disease is named after Lyme, Connecticut, where they first discovered it. Okay, so it's named after something. That's a pretty easy way to find stuff, actually. Or the abbreviation like an MRI. All right. So there's lots of ways to look stuff up. Once again, my advice, you're reading, it says like procedure, or like an op report, and it says procedure, right? If you can't find it under the word you think you can find it under, look under the other words, okay? And there's ways, once you get more comfortable with it, to make that search faster. So if you think about it, right, say we're doing a lung biopsy, okay? I can find that under either one of those words, okay? But if I go to biopsy, how many things do you think they can biopsy?
Gazillions.
Gazillions.
Yeah.
There's a lot less stuff under lung.
Right.
So if you go to biopsy and then lung, or you can go to lung and then biopsy, and you can find it faster. It's just one of those speed things. You know what I mean?
Yeah.
Or easy things too, because
Right.
there's pages and stuff I gotta look through. Okay, so this helps a lot.
Okay.
I'm going to walk through some of these sections really quick. We'll finish up with evaluation and management because it's its own thing. So let's start with anesthesia. It's your second section. It's a very small section.
I think that's like the most annoying section.
Well, I'm going to give you a gold star tip, and it will not be annoying anymore. Okay. All right, so these are the professional services of the anesthesiologist. General anesthesia is billed separately from your surgery. It's not part of the surgical package. You go get like major surgery, you're going to get a bill from the surgeon and another one from the anesthesiologist, right? Okay. Now, there's not like if I go get stitches, they're going to shoot lidocaine or whatever that stingy stuff is in there. Okay, that's not. That's just like a local anesthesia. Okay, this is like pain management, general endotracheal anesthesia, that kind of stuff. Okay, all right. Anesthesia is kind of a weird thing. It's billed. Not going to go into it too much because we're going to run out of time if I get too deep into the weeds here. But there is a time component to it. Okay, basically what they kind of look at to build, it's kind of built on its own little weird thing by units, because I know that's something that's confused students in Practicode as well too, because it'll say units. Most things are one. It's like, how many applications of a cast did you get? One. That's 1 unit. Okay? Okay? See what, I know, overthinking, and I get it. Because that's what shows up on the plane. It's easy to do. Like I said, we can get in the weeds pretty fast. But, so say it's a finger fracture repair, right? But I have 3 fingers, and it's the same code, right? Then it'd be 3 units. Finger 1, finger 2, finger 3. Okay? Right. So how many of that CPT did they get? Right. Okay. All right. This is a short section. Here is the magical trick to coding for anesthesia. In your alphabetic index, go to the word anesthesia. Do not go anywhere else. Here's why. Because if you're coding for anesthesia for a mastectomy and you go to the word mastectomy, you're going to be coding for the mastectomy, not the anesthesia for the mastectomy. Do you see what I'm saying? Flip back here to anesthesia and you can see what I mean. So see, all those procedures and services are back here.
All the way to here.
All the way to here, that's right. You don't want to code for the procedure itself. If you're coding anesthesia, okay, you want to start here. Even though the anesthesia section is so small, you'd think you could get away with just going to it up in the front and finding it. I wouldn't. And here's why. Because you might go up here and it's like anesthesia for cleft lip repair, and I've got a code. When I go up front, it might just be like anesthesia for facial services or something. You know what I mean? And this is your best way to get there. I wouldn't skip this step. Once you get more familiar with the CPT, you don't necessarily use the index as much. But for right now, okay. There's also specific physical status modifiers for anesthesia patients, which are appended. Basically, it just says, how bad was the patient? Because, like, if I'm doing anesthesia on a normal, healthy patient, that's what they charge for. But if it's like for somebody under the age of 1 or over the age of 70, you know, that's a whole different ballgame. Or if it's a patient who's actively dying on the table, you know, I'm going to charge a little more.
Turns out.
Yeah, I would too. That's right. Anesthesiologists make a lot of money too. My daughter's boyfriend, his dad is a CRNA, a nurse anesthetist. They have a pool. I know, right? Okay, yeah, we want to go to dinner. He wants to pay, I'll let him. All right. He's a nice man. All right, so when you're back here in the index, so you're going to notice, you know, in ICD, you go to find one thing and there's one code to go look at, right? But back here, I might have several codes to go look at, or a range of codes or something like that. It means you need to go up front and look at all those codes. I always just keep a scratch pad and a pencil. I have to code with pencil for some reason. I don't know why I like it better that way. Maybe I feel like I can erase stuff if I do something dumb. But but I always, I just write them all down, and that way I don't have to keep. Because apparently my short-term memory is not good enough. I can't remember it in the 2 seconds it takes to flip to the front of the book. But no, but seriously, I mean, especially if there's like a big range of codes or something, and then I can kind of think on paper a little bit too. You know what I'm saying? So you'll find your code, your standalone code, or your range of codes, or your options here, and then come up here. Okay? All right.